Hi guys, welcome to today's video, which is about the role of the healthcare system in relation to funding, sustainability, access and equity. So let's get into it. First of all, you probably remembered these 4 points: funding, sustainability, access and equity, which we went through straight from the study design dot point in I think 2 videos ago. So we're going to go through them, and basically what we're talking about is the role of Australia's healthcare system in meeting these 3 areas which the government deemed to be essential. So funding. So this relates to financial resources which ensure that the health system is well staffed and equipped, because healthcare systems obviously cannot run efficiently unless they have the finances to staff and equip their hospitals or healthcare buildings. It also relates to building infrastructure and ensuring that hospitals can fund highly trained health professionals. It can somewhat subsidise health services, so e.g. Medicare, and also involved with public health programs such as Quit or Live Lighter. And this is a really important point to note, is that funding is becoming in higher demand, and it's because of this thing called an ageing population. And I think we have become aware in the last few videos that life expectancy is increasing. So our population is becoming older and older, and consequently there is a larger strain on our healthcare system. So we need more funding to combat that, as well as advances in medical technology, which means we have more expensive technologies which need to be funded. Okay, so our next one is sustainability, and this is basically ensuring that healthcare systems can run smoothly and effectively well into the future, and that they're running efficiently. So we're not spending too much money, which means we can keep these processes going well into the future. So it's focusing on infrastructure, such as workforce, facilities and equipment, being innovative and responding to emerging needs to ensure effective development in medical services. So infrastructure, of course, if we build a very high quality hospital, then it's going to last us a long time into the future, and we won't need to be spending funds on things such as repairs. So that's very important in terms of sustainability. And these things such as emerging needs, this is basically, what it basically means is targeting the up-and-coming diseases which are emerging. So as I said before, with our ageing population, conditions such as dementia are becoming more prevalent, and so we need to respond to these emerging needs to ensure that the healthcare system is sustainable. So private health insurance is this acronym. So basically what I've done here is talking about how private health insurance, the PBS and Medicare all fall under this sustainability umbrella. So the private health insurance, it definitely responds to the emerging needs of individuals by including alternative treatments such as optometry. The pharmaceutical benefit scheme also responds to emerging needs by regularly updating which medications fall under the scheme to accommodate for prominent needs. And Medicare provides healthcare with the latest equipment. So it's also ensuring that infrastructure is being built and the latest equipment can be accessed. So you'd be listing these points if you got a question that said, how does private health insurance respond to the role of the Australian healthcare system to be sustainable? Something like that. Okay, so our next one is access, or being accessible. So it's for the ability for people to obtain care at the right place and time, irrespective of income, culture or physical location. So this basically means no discrimination. And to ensure that anyone can have equal access to healthcare, or if not equal, they can have sufficient access, regardless of how much money they have, their cultural needs and their proximity to a healthcare system. And so how the Medicare or the pharmaceutical benefit scheme demonstrate this is that anyone can access Medicare or the PBS regardless of their culture, physical location, gender, etc. And that's one of the really good things about the Australian healthcare system, is that no one is discriminated against. So it's definitely very accessible. And our last one is equity. So ensuring that all Australians can access healthcare when required. So just remembering that this is not equality. Once again, don't get these two terms mixed up, but equity. So communities such as Indigenous communities will have different needs to non-Indigenous. So we don't want everyone to have the same, but we need to work with different communities, determine what they need so everyone can have the right to a good healthcare system. So an example for this is Medicare provides healthcare to all Australians and takes into account funding based on their income, because remember we had the Medicare levy surcharge. So people with low incomes are exempt from this, so they don't have to pay as much, which is awesome, because based on their income it would be a much larger proportion. As well as the National Disability Insurance Service, and this is helping people with disabilities receive healthcare. So once again, rather than providing everyone equal opportunity, we're working with the more vulnerable people to help bring them up so that we can have similar health outcomes. So just the going on to access and equity in terms of talking about them together, I think it would be easy to get them mixed up or somewhat conflate them, say they're very similar. But equity is more targeting the vulnerable groups. So target vulnerable. Whilst access is just making sure that healthcare is so accessible that anyone can access it, regardless of wherever they're coming from or how much they can pay. Whereas equity is more concerned with how do we boost our vulnerable communities. Okay, so I'm just going to go through a couple of exam questions and how we can answer these properly. So Medicare is Australia's universal health insurance scheme. Briefly explain how Medicare is funded. Okay, so to finish off, we're just going to try and answer some exam questions so we know how to talk about these healthcare concepts. Okay, so question 1. Medicare is Australia's universal health insurance scheme. Briefly explain how Medicare is funded, 3 marks. Okay, so 3 marks, we know that we need to talk about our 3 things, which are the Medicare levy, general tax, Medicare levy surcharge. And so, because it says explain, it's not enough to just list them. So we have to explain what they mean. So Medicare levy, we can say all Australians pay a Medicare levy tax, which obviously goes towards funding Medicare. General tax, a percentage of general tax goes towards Medicare, and the third one is high income without private health insurance pay the Medicare levy surcharge on top of their Medicare levy. Just make sure that you're saying without private health insurance, because remember that is an incentive for them to take out private health insurance. B, identify 2 services covered by Medicare. So I think some of the easiest ones are GP consultations and public hospital visits. And it just says identify, so you don't need to explain, you just list. Outline two differences between Medicare and private health insurance. So choice of doctor in hospital, so that is for Medicare. Oh, sorry, not Medicare, private health insurance, not Medicare. So it's important to say which one includes and which one doesn't. And alternative therapy such as physio, private health insurance, not Medicare. Other ones you can talk about is private health insurance. You have to pay a premium fee, whereas Medicare you don't. Private health insurance, shorter waiting lists, Medicare, long waiting lists. Everything that we talked about in 2 videos ago. Question 2. Explain 2 ways in which the pharmaceutical benefit scheme can promote health and well-being of individuals. So we're talking about health and well-being, and this may seem very ambiguous or grey when you read it, but what it's asking you is link 2 dimensions. So the 2 dimensions that I chose were physical health and well-being and mental health and well-being. And so these are obviously very brief answers and not good enough, so I'm going to expand on them. So PBS allows individuals to have medication to treat disease, therefore more likely to cure the disease, which increases physical health and well-being. And then we can lower stress as there is less financial strain to receive medication, and lower stress levels will improve mental health and well-being. Awesome, and because it is 4 marks, I think. And it says 2 ways. So I think you would get 1 mark for mentioning physical health and well-being and mental health and well-being, and 1 mark for explaining the links between the PBS and these 2 dimensions. And the last thing I just wanted to show you, this is more of an out of interest kind of thing. I don't think you get examined on it, but it's really good chart kind of diagram, and it shows how different sectors of the healthcare system are funded, and it's using colour coding. So I think just look at that in your own time if you're interested, but don't stress about memorising things too much.